At Mahajan Medical Center, we care to listen to our patients. Proudly serving the needs of Tampa Bay in primary care for 25 years and counting. Right, let's talk about the variants a little bit. I know that's been in news quite a bit, so let's put them on the screen. So these are the common variants out there. Do you want to talk about them a little bit quickly? I know it's very technical, but maybe touch on briefly.
Absolutely, yeah. So, as I said, the variants have multiple mutations. We are calling double mutant, triple mutant. They have much more mutations than that. What mutations we are also interested in are the mutations which are affecting the spike protein, because that is the protein which makes the virus enter into the cell before it start replicating. So these are called variants of concern. By WHO has classified as a variant of interest, concern, and of fatality. Variants of high consequence. There is no variant of high consequence as of now. Mostly variants we see are the variant of interest, which are normally variants which are passing into our community is the variant of interest. What we are worried about is the variant of concern, when there is evidence of increased transmissibility, more severe disease, that is increased hospitalization and death, as we are seeing in India right now. We saw UK, we saw Brazil. Significant reduction in the neutralization by the antibody generated during the infection, vaccination, or the treatment like monoclonal antibody. Then we call them as a variant of concern. These are the variants which actually will lead to massive tsunami of the second phase of the vaccine of the infection. So the original virus these are named with the Pango lineage or next strain method. We don't want to go into that. The SARS-CoV-2 original virus was from Wuhan. As we know, it is technically named as D614G. The British variant we saw had named as B117. I will go by the technical name rather than the country name. I don't want to use the country name as a first initial for those strains. So they saw these three mutations in the spike protein. These are either substitution of one amino acid to other, or there was a deletion. What they have done, particularly this mutation N501Y or 618H, they affect the spike protein receptor binding domain and increases the entry of the virus into the cell. When the virus enters very quickly, it replicates very quickly and spreads very quickly. So it increases the infectiousness of the particular virus. And those are the mutations responsible for that. Now, the other mutation is that deletion of HV6970 that results in the evasion of your immune system. Your vaccine sites from the spike protein are actually missing, and then the vaccine does not work properly. And your antibodies from the previous infection doesn't work. That means you will have the reinfection. You are sick with the virus and you are in the hospital, you're getting convalescent plasma. That's not going to work because of the mutations. So it basically results in the increased infectiousness, so more spread. For example, in California, we saw the mutation 501Y and 493LR, and that was 20% more infectious than the original virus. Although there was a question about it was more severe infection or not, but we saw that in Brazil, we are seeing that in India, that there is more people getting sicker, although the data still has to come from India yet.
Still, there was a new study yesterday that Pfizer vaccine, mRNA vaccine, is pretty effective against the Indian strain, the 1.617, B1.617. So, so there is no need to panic. You got to still use the vaccine. You got to still use your common sense. Use the social distancing, use the masking if there is a high caseload in your community. And we'll see, these viruses in my opinion, become, as the vaccination goes up, will be community to community difference. So in other words, if a community have high vaccination rate, they will have less caseload in those communities.
COVID is going to stay with us, Ranjan. I hate to say that, but that's the fact. Question is, will it be causing that much severity of illness, or will it be a mild cough and common cold like disease? I don't see that happening in next 1 or 1.5 year at least, until everybody is vaccinated and we stop this virus from replicating and mutating. But it will be around, it will be there for a long time, and vaccination is only way we will be able to prevent it. We may not be able to eliminate it like influenza. Influenza, we get vaccinated every year. We're still around the country, communities, and but people get very mild sickness. They are back to the work in 2 days. Universal hygiene methods, hand washing always works. Washing hand is an important part of your hand hygiene, is important part of your any activity you do in the hospital. Masking definitely works. So hand hygiene, masking, social distancing, and vaccination, these are the four things you should be focusing on to prevent these uh, any kind of infection, not just the COVID, any kind of respiratory illness. You will see pneumonia will go down, the bacterial pneumonia. You will see all these viral infections will go down. Um, and in hospitals, initially with all those PPE kits, we saw C. diff infection going down very quickly. There were very less C. diff infections. So, personal hygiene and personal protective equipment, they both are important and they both work for sure. And that's the key.
Right. So the take-home message is, unless you have, Guillain-Barré with vaccination in the past, take the vaccine. Unless you have serious side effects from vaccination in the past, because COVID is unpredictable even in younger folks. Point number one.
Absolutely. Anaphylaxis to any component, or Guillain-Barré, as you said, these are the only two major contraindications,
Right.
which
So if you have
you should.
allergies to different things, that's not a contraindication. Take your EpiPen with you, but the
enough
risk and
enough
benefits.
Yeah, unless you have anaphylaxis. Yeah.
Right. So that's number one. Number two, what you put on the slide, keep doing the social distancing till, everyone in your household has been vaccinated, and, keep in that bubble. Now, if someone new comes in, you got to be careful because they may be asymptomatic carriers, so you got to use your own common sense there. And then hand washing is always useful. And if you're in a hospital setting, nursing home setting, PPEs are fantastic in preventing barriers for any infection, not just COVID.
One more point I want to add, as you might have heard from some people, and I have heard from some people, after getting the vaccination, people getting their antibody level tested, and they say, "Hey, I don't have antibody." So when you get a coronavirus infection, you get a polyclonal antibody. You get antibody to nucleocapsid, you got antibody to envelope protein, you got antibody to spike protein. The test which the labs are using is the antibodies to nucleocapsid, and we are giving the vaccination to the spike protein. So if you really want to get tested after the vaccination, you should get the test for the antibodies to the spike protein, which is not very much commonly offered. I think only few labs are offering that. So don't get worried if somebody say, "Hey, I got vaccinated and I got my antibody tested, and they are just giving water to me." So that's not a right answer. I think the test is wrong, and we are looking the wrong antibody after the spike protein vaccination. So I think consult with your doctor before you get tested for the antibodies.